Welcome to the podcast series on GBV Learning Impact, funded by the Safe from the Start project. I am your host, Liloba Paul, Senior Learning and Development Officer on topics related to gender-based violence. This work is a collaboration between the UNHCR Division of International Protection, the regional bureaus, and the Division of Human Resources Global Learning and Development Center in Budapest. It is my pleasure to have with me today Clementine Cremer, Senior GBV Officer in the Regional Bureau for Eastern Horn and the Great Lakes, also known as EHAGL. Thank you for joining me from Nairobi.
Thank you. I'm pleased to be here.
Could you tell us a bit about yourself? How long have you been working with UNHCR? Where are a few places you previously worked? And perhaps a little bit about what you're covering in your current role?
Well, I started with UNHCR actually as an implementing partner in Haiti, where I spent 7 years. Then I worked for UNHCR in DRC for the car emergency response on GBV specifically. And also spent 3 years working in Burkina Faso. And I'm currently providing support and oversight to 10 country operations here at Eastern Horn and Great Lakes Bureau, and also conduct field missions to scale up GBV prevention, risk mitigation, and response programming in emergencies in the region.
Well, thank you. And that's quite a remarkable career. I would like to remind our listeners, too, what we're here to talk about. And we're here to talk about your experiences and your perspective on GBV learning impact and how we are following the results chain in practice. We also would really like to know from you, Clementine, what makes a difference in your overall work. So let's start by focusing on the GBV learning with the GLDC that you would like to highlight.
So I was a facilitator for the GBV Risk Mitigation National Workshop in Burkina Faso in 2021. And at the time, I was a GBV officer. And with the senior CBP officer, we co-facilitated this workshop on GBV risk mitigation, and we used the GLDC learning material, the facilitator guide on mainstreaming GBV risk mitigation. The participants included UNHCR colleagues from Shelter, CCCM, WASH, Livelihoods, Education, CBI, and Program. Protection colleagues also joined from field offices, and the heads of sector, the different sectors were from national and field offices. And we were supported with coaching sessions provided by GLDC to adapt the workshop agenda and materials and focus on the GBV risk mitigation actions to be implemented by technical sector colleagues and partners after the workshop.
Good. I think that's pretty clear, all of the work that went into the workshop itself. I'd also like to know about your thinking before the workshop. And what did you know already going into that workshop environment that would really make a difference on the ground for communities?
Um, when it comes to GBV, having access to services and the information on where to access those services is fundamental. And also being able to safely disclose a GBV incident to anyone on the ground. All frontline workers should be able to have the appropriate behavior when it comes to a GBV incident disclosure, including local actors. So every frontline worker should have the knowledge on where those services are. And also strengthening partnership with local actors, and more specifically refugee-led and women-led organizations should be enhanced. And we should also include them in planning, coordination, and training as facilitators. Through strengthening those partnerships, we can build in sustainability long before UNHCR departs from an area.
And what actions did you take after the GBV risk mitigation workshop to work towards reaching this end goal?
So after the main workshop, several action plans were elaborated. I also conducted a series of field office trainings to ensure all colleagues had a good understanding of their roles and responsibilities, but also were well equipped when it comes to GBV safe disclosure. So we had condensed training and safe disclosure and referrals. I also conducted two specific presentation sessions and Q&As with CCCM field actors, so neutral partners, governmental authorities, and also provided presentations for the shelter and housing land and property during coordination meetings.
And the role that you carried out in supporting sector engagement and follow up on GBV risk mitigation measures is clear. You were quite involved in working with a lot of sectors. What outcome related to GBV did you see in the operation as a result of your actions?
Shelter, WASH, and CCM colleagues were extremely engaged after we conducted this training. The shelter colleague invited me to a session with partners, viewed PPAs and their strategy just to ensure that risk mitigation was incorporated. We worked on indicators that were also included in PPAs to be able to measure risk mitigation. And that was a very good exercise. The discussions were realistic and based on what was feasible to report and how to collect information. The main issue is staff turnover. If someone hasn't been trained, it's difficult to understand what their responsibility is with regard to GBV risk mitigation. So the need to continuously start over it's tiring, but continuous engagement is necessary. I also realized that the relationship with reporting colleagues plays a major role on visibility and our ability to report on impact. So reviewing the results of interventions moved forward, but this was not smooth. Colleagues in protection also do not fully understand their role in reviewing PPAs, budgets, indicators, and working with partners to go beyond their subject matter knowledge and understand how programming functions in the organization.
Yes, you mentioned staff turnover specifically, and this is indeed tiring to continuously start over, building relationships and getting buy-in again. We can also hear from your example around reporting and visibility that also the strength of relationships still plays a major part in being able to show impact. What were some of the other challenges you faced?
I would say one challenge was the sector programming process and inconsistent link to GBV risk mitigation in their budgets. Also, when we are short on staff, it's challenging to be structured and thorough. The follow-up with action plan requires daily support, and if colleagues cannot finish their action plan, implementation moves forwards, but the structured documentation may be lacking.
Yes, working and doing all of that on a daily basis is key. And the tracking also within sectors requires indicators and commitment by the budget holders. Thanks for bringing that up. Let's also go one step further here. As a result of this GBV learning outcome in the operation, what impact did you see on the lives of people forced to flee?
After the workshop, a lot of colleagues and heads of sectors realized the importance of implementing measures to mitigate risks when it comes to GBV. So I was extremely surprised to see so engaged and numerous field officers budgeted in their direct implementation for the implementation of such measures. Some of them decided to implement lighting in IDP sites, and that had a tremendous impact on displaced communities, and more specifically on women and girls. A large number of frontline workers also were trained on the safe disclosure and referral of GBV incidents, including carpenters. It was extremely moving to see how they were engaged and how they understood their responsibility. It was not just fixing up or building shelters, but it could be more. And I'm sure a lot of them were able to support GBV survivors and ensure that they accessed the assistance they needed, but also to mitigate GBV risk by once again understanding the impact their work by providing shelter repair or construction contributed to reducing GBV risks faced by IDP women and girls. For example, needing to ask for favors to fix and maintain a self
Mhm.
shelter.
And what impact did the GBV learning intervention have on you?
Well, as a facilitator, I learned so much during this program. Sector colleagues were extremely engaged. I understood the implications of engaging myself to work with other sectors that did not yet see themselves as natural partners in the fight against GBV, and how the risk mitigation, how to open the risk mitigation world to them.
I think our listeners would also like to know about the working conditions you were in. There were certainly factors that helped make your work possible, to plan with colleagues, get results, and also show the outcomes and impact of your collective work. What enabling factors in your working environment supported you?
Well, I was extremely lucky because senior management were fervent supporters of GBV work in Burkina Faso, and the good relationship also that I had with program also facilitated getting the GBV mitigation work done with the clear understanding that this was a priority for the organization. Many sectors didn't see the importance of their role before the workshop, and following the workshop, colleagues could see how to engage and how I would continue to support them in their work. Without the support of senior management and program, it would have been more challenging for sectors to take the space and time for the work. Also, without the patience and energy of you, Leloba, providing coaching in the GLDC and the support of Clarice in the Regional Bureau for Western Central Africa, this would not have taken place in such an impactful manner.
Thank you. And yes, those roles that are enabling factors are quite critical, also at the regional level. What are some suggestions or advice that you would want to share with other members of the UNHCR workforce to help them show the outcome of GBV learning on their operation, and then go further to show the impact that it has on people's lives?
Well, I would say that it's important that protection staff understand how programming functions in UNHCR, and also building relationships with not only program, but also colleagues from other sectors. We should be careful not to work in silos because we can easily be overwhelmed with our daily work and tasks. And protection colleagues have to be a bit more proactive in engaging with other units and sectors, reaching out to external engagement colleagues to ensure visibility of these concrete measures to reduce GBV risk is also extremely important.
Yeah, and thanks. Those are some very good suggestions. I have a couple of more questions before we start to wind down. And I'd like to know how this GBV learning experience you shared informed your current work.
When I first arrived at the Regional Bureau, I naturally engaged with heads of sectors here at regional level and discussed how GBV risk mitigation was incorporated into sectors programming across the region and heard about a lot of good practices. So I organized a series of discussions with education focal points in the region, well, education sector, livelihoods, and we'll try also to continue this with shelter colleagues, WASH colleagues, because they have implemented a lot of very good measures into their programming. And I really want to hear from them. I really want to be able to document those good practices and maybe give some other sectors some additional motivation for sectors that may not have been so active and on how they can integrate risk mitigation into their programming.
Okay, yes, that makes sense. And I can see how you've been able to apply a lot of what you did before to your current work. So, what do you see in the bigger picture as a way to create a lasting impact from GBV learning that's more sustainable? For example, when funding is greatly reduced or after UNHCR departs?
Well, it is essential to invest in local actors and specifically women led organizations. They have shown how they may be the first and most effective respondents in constrained situations. We've seen it for the Sudan situation, but in so many other contexts, they have proved that they remain on the ground and they continue providing assistance to GBV survivors when international actors are long gone. But UNHCR should lower some of its requirements for partnering with small women led organizations because this is a barrier for increasing investment in localization.
And thank you, Clementine, for your time with us and sharing one of your experiences on the impact GBV learning had on you, also on your operation at the time, and your work today.
Thank you very much for having me. It was a pleasure being here with you.
And to all of our listeners, thank you for joining us. Do tune in to the next podcast in our series from the GLDC on GBV learning impact in UNHCR.